Welcome to All Things Financial with Jack Driscoll. Each week, Jack takes on all things you thought were hard to understand about your finances and makes it fun, easy, but most of all interesting. From insurance to the best way to save your money and squeeze the most out of the dollars you put aside for your rainy day. And now, you have a friend in the money business. Here's your host, Jack Driscoll.
Welcome back again, everyone, to another edition of All Things Financial. What I wanted to go over today is something we haven't gone over a lot on this show, and that deals with health care, health expenses, and health insurance under the new Health Care Act. You have a lot of different options available, and I know it's highly misunderstood as to what element of control you do and do not have in choosing the type of insurance that you have, choosing how to reduce expenses for the levels of care, for prescriptions, for medications. So I thought I'd go through a number of different options that you do have control over to help reduce, potentially, your expenses for health care, premiums, deductibles, and copays. So let me get started right away here. The first thing is, no matter what type plan you have, do your best to stay in your network. Whether you have an HMO or a PPO, an HMO is a health maintenance organization. A PPO is a preferred provider organization. The difference is mainly the health maintenance organization almost always requires you to get all of your health care from administrators, doctors, facilities within the network. Most HMOs won't allow you to go outside of the network and still pay. So a lot of times, if you have a specific surgery that needs prepared or needs accomplished that's through a doctor or facility that happens to be outside of your network, it is possible you might be on your own, even though you have full health insurance because you have an HMO. The PPO, on the other hand, or Preferred Providers Organization, typically has an in-network cost program where that's the most favorable, where you have the lowest copays, lowest deductibles, or maybe no deductibles, in operating with your doctors and facilities within their network. But most preferred provider organizations allow you to go outside the network at a higher cost, but they will still provide coverage, unlike some HMOs where there's no coverage that will apply in a lot of cases outside the network. So keep that in mind and look at what you have. Now, a lot of people with the HMO say, well, I'll just look at the list of doctors and make sure all my doctors are on the list, and I'll be comfortable dealing with the HMO. My caution as a financial planner is, if all your doctors are on there, and then you're in a car accident and you need a specialized surgery, that could lead the general practitioners or the emergency room to direct you to a specific level of care that you've never dealt with those doctors or had those needs before. And the best doctor, or the one that's available at the time, if it's not an emergency, the HMO may say no coverage at all, where if it's an emergency, like I just mentioned, the HMO may say there is coverage only due to an emergency. But imagine the case where you came down with an illness, a specific illness that you never had dealt with before. It's not considered an emergency, but it is a specialized condition, and now you need a specialist. You look through, and there are no specialists that are being recommended or work with your doctors that are in network. Now you have a problem. You want the best care for yourself, and your HMO may prevent you from being able to get it if you need them to pay for it. So be very careful with HMO versus PPO. Now, there's a price difference. The HMOs are typically built to be a lower premium than the PPOs because of the additional flexibility you might have with the PPO. Okay, now, you'll see higher costs in a PPO in many cases, even if they do allow out-of-network coverage. And it might be 10% copay in-network versus 50% copay out-of-network. So it's still expensive, but you have to be careful with that. That's the first point I wanted to make today. The second one is you can actually look and see who's providing the care. When your general physician says, I want you to get additional tests or I want you to get treatment, you can actually ask them what providers offer that. Rather than just going with the first one named, you can ask, are there 3 or 4 different types of providers that you're already comfortable with? And what you want to do is you want to talk with the health insurer and ask, are any of those providers what they call super preferred providers, especially if you're in a PPO, but even in an HMO. What will happen is, even though they're all in network, some providers have negotiated pricing with PPOs and HMOs, healthcare insurers, that they offer super discounted fees for the same care that others have not negotiated those super discounted fees. So ask for the super preferred providers question or list when you're looking at those types of treatments. All right, another way you can save. You could save at standalone radiology centers, for example. You know, there was an example brought up in a Kiplinger's magazine recently that said among all facilities within 25 miles of New York City, the cost of a knee MRI ranged from $238 at a freestanding radiology center to $2,000, almost $2,200 at a hospital. So you look at that, and that was a vice president at United Healthcare that came up with that finding. And what's happening are you look at these outside standalone providers at so much lower cost. And if you're in a PPO or HMO, you might be paying a lot or all of that cost. That matters dearly to you. Or let's take the case of any plan where you haven't met your deductible yet. And now it's $2,100 at the hospital. Yes, you're meeting your whole deductible, maybe if it's a $2,000 deductible. But boy, wouldn't it be a lot nicer paying only $238 toward your deductible? Because what if no other care was being done for the year? You'd get off saving almost $1,700 that you'd never have to pay. That brings up another point. What happens if you haven't used your insurance all year, you haven't needed medical care, and you're near the end of the year? Now, some people on these voluntary or elective tests may elect to choose to put it off until January 1st if it's not a health consideration. So if it's a knee that's been bothering you 3 or 4 or 5 years, you're looking at finally taking it no more, and you're going to look into this, and it's November because the weather got cold. Look and see if you have not satisfied your deductible this year and haven't even started on it. You may actually want to consider asking the doctor, does it matter if I do it in November or whether I do it in January? Because then you may as well start your deductible in many cases in the new year while you have the whole year then after you've met your deductible to get free benefits or next to free benefits from your plan, rather than doing a $2,000 or $2,500 deductible in November and then meeting that all over again starting January for the following year. You could see what a waste of money that might have been. So that's a little tip for you there. I also want you to ask your surgeons, if you're looking at elective surgery or mandatory surgery, if they're less expensive facilities. Ask the surgeon if they practice at several different hospitals or facilities, and ask them what the cost difference is depending on which facility you have that surgeon operate in. The surgery costs will typically be the same, but the facilities costs could differ widely. So you want to ask the surgeon, I know you'll be paid the same, but which facility is less expensive, and decide whether you want to go there or whether you want to go to a different outpatient surgery centers, for example, might save a lot of money. Another example, there's an average cost nationwide, let's say, for a GI endoscopy or arthroscopy in a hospital, which is $2,500 roughly. But the average cost for that same treatment in an outpatient outpatient surgery center is $959. And Cigna had come up with those findings. So I want to share these different ideas and strategies with you because many people never evaluate all the different ways that money can be saved. They just take for granted. Someone like yourself maybe watching or listening to the show takes for granted, I don't know, whatever they charge, that must be what's right. So I want to share this information as I come across it, obviously, to help a lot more of you viewers and a lot more of you listeners on the radio. Okay, here's another one. I want you to research emergency options ahead of time. Now you'll say, how do I evaluate or research emergency options ahead of time when I don't even know what an emergency is? That's why it's an emergency. Well, here's what I mean. As soon as you get your policy, whatever your policy is, I want you to see which nearby hospitals and urgent care centers are covered as in-network providers. So all I'm asking you to do is line up in advance. If I have an emergency, and write down for your family in your maybe family records book or whatever, if I have an emergency, take me here. And if they can't handle it, then take me here. So that you've done the research in advance on where in-network emergency or urgent care will be covered for you without being greatly expensive when it could have been avoided. All right, now, it goes without saying, steer clear of the emergency room if you can, unless it's a medical issue that you say it needs done in an emergency room. And then, for most of us, costs go out the window. We want the best care possible. But that being aside, what you want to do is think about this. When you have something that has come up, don't just run straight into the emergency room. It's expensive. It's the most expensive place to get any level of care. So if there are quick centers nearby, urgent care centers, other alternatives, consider those. It is up to your doctor. You should call your doctor, but if at all possible, evaluate the differences in advance so you know where you want your family to take you or where you want to go. You'll find in a lot of cases on a national average, again, you'll see an emergency room being maybe $1,500 roughly for a level of care that might be $135 at an outpatient facility that you might have been able to get taken care of at the same. And at a convenience care clinic, it might be as low as $38 to $40 for that same type of care. So keep that in mind. All right. Let me take a quick break. We'll be right back with more ideas on how to help you save money on your health care costs and coverages. We'll be right back. Okay, we're back again, everyone. I wanted to continue sharing with you some ideas I've come across, shared with some of my clients, and can share with you also on how to help reduce these medical costs that become so burdensome for us. So let me continue where we left off. The next idea I have for you is basically how to save money on your medical tests. Now, one of the biggest things we find, fees for lab work. They're all over the map. And what happens, for example, the same blood test, and this is all over the country. In the Denver area, United Healthcare said, ranges from $10 to $165. And it's this way all over the country. So when your doctor requests an outpatient test, ask whether you can get it at an independent lab. You and I both probably just take what our doctors say for granted. So they write you up a prescription. They say, we want to do an outpatient test. Go here, wherever it is that they write down, and we do it. And what you need to do is you need to ask them, wait a minute, are there any outpatient labs that also can do that test that you would approve, that you would accept, and are equally high quality? And they might recommend someone like, well, yes, we do go through Quest Labs also, and you may find your insurer also has discounted fees arrangements with Quest Labs. Now you're in business. So you've got Quest Diagnostics and a lot of different opportunities available. You don't have to just run to the first place because the doctor never thought about price. They were just thinking who might be most convenient. All right, now, you look at the generics. When you're looking at generic drugs, there's an interesting situation. We all know generics are less expensive than the traditional drug by the makers. There is supposedly a little difference in the chemical makeup, so be careful with generics. But I will tell you, if you're doing the generics, what we're finding is this. The copay, if you take a generic and you pay cash and you go somewhere like Walmart or Target for their generic, you may pay only $4 for a 30-day supply of some drugs. You might pay $10 for a 90-day supply, as opposed to if you go through the insurance company for generics. Some companies charge a $10 copayment for a 30-day supply no matter what. So you're paying more than the actual cost of the drug if you paid in cash, because you're going through insurance and the copay is actually higher than if you just paid it in cash. So most generic medications cost less if you don't use your insurance. David Belk is a physician in the San Francisco Bay Area, and he lists drug prices on a website over there, and he says most generic medications cost less if you pay cash and don't use your insurance. So I'm not subscribing to that. I am sharing with you a possibility of that. All you need to do is get to these discount outlets, ask them if you pay cash, how much for this prescription, versus if you go through the insurance, and see what your copay is. You might be pleasantly surprised. Now, when you use preferred pharmacies, let's jump over to the pharmacy side. If you use a pharmacy, you want to find out from your insurance companies, do you have any preferred pharmacies? Interestingly enough, same medication, just whichever pharmacy fills it for you, can make a big difference. What we've seen is Humana Walmart RX plan for Medicare Part D, which is prescriptions, for instance, charges a $1 copay for a 30-day supply of certain generic drugs purchased at Walmart or Sam's Club. Now, or there's no copayment at all through some of the mail orders. But there's a $10 copayment, like I just mentioned a minute ago, for the same drugs purchased at a non-preferred in-network retail pharmacy. So you've got to shop around. You've got to be careful here. The next thing is, when you're talking about prescriptions, ask for a prescription for over-the-counter drugs. Now, the reason you want to do that sometimes is you can no longer use your tax-free money from a flexible savings account, or a health savings account for that matter, for over-the-counter drugs without a prescription, except insulin. So to get reimbursed for over-the-counter drugs for a health savings account or a flexible savings account, you have to ask your doctor for a prescription for those medications. And then what happens is you're able to take deductions and pay for them out of the flexible savings account or the health savings account, where otherwise you're not allowed to do that without the doctor prescribing those over-the-counter medications. So that's a good tip there. Now, you can get help from special drug programs. If you go to the National Council on Aging's benefit checkup site, and that site is www.benefitscheckup.org. If you go on that site, you can anonymously put information in, basic information about your income, your assets, medical conditions, and drugs, anonymously. You'll see whether you qualify for any special programs to help with drug costs, such as drug manufacturers, patient assistance programs for low-income patients. You may get discount prices just based on your income, assets, and other medications you have, and don't even know it. So there may be government programs out there, because you can enter that information anonymously, that may help you out. So again, that's www.benefitscheckup.org. All right, now, we talk about preventative care. Insurers are required by law to provide several kinds of preventative care without any cost sharing from you, regardless of your deductible. A lot of people don't know that, I know. But you could see the preventative care page at healthcare.gov or the preventative care section of medicare.gov and find out details for this. But preventative care, that's anything, diabetes, cholesterol tests, mammograms, colonoscopies, flu shots, blood pressure, so many things that we do routinely that would not typically be covered under insurance. Actually, they're required. If you go to these websites, you could find out which types of treatments and different types of visits you have that might be able to actually be covered and be required by law because they're preventative. Now, the preventative care rule applies only to in-network services. So be careful that you're dealing with in-network when you get this care. It's not unusual, for instance, for an anesthesiologist involved in a colonoscopy to be out of network. So you're getting a colonoscopy. It is preventative. Colonoscopies are covered. And here you get a bill for an anesthesiologist because the anesthesiologist was out of network. So remember, everybody has to be in network for that plan to work. I know I'm sharing a lot of information with you today, and thank goodness, because otherwise how would you have access to all of this? But I wanted to share a lot of these ideas and try to help as much as I can most of you who have these types of concerns. Now, we're out of time for today, and for today's show, I'm going to have to wrap it up here. Next week, I'll continue with more ideas on how to help save money on your health care, health insurance programs, deductibles, and private pay. Thanks again for tuning into All Things Financial, and we'll be back again next week.
You've been listening to All Things Financial with your friend with the answers to all financial matters, Jack Driscoll of Driscoll Insurance and Financial Services. Securities and investment advisory services offered through SagePoint Financial Incorporated, a registered broker-dealer and registered investment advisor and member FINRA and SIPC. Driscoll Insurance and Financial Services is not affiliated with SagePoint Financial, Inc. or registered as a broker, dealer, or investment advisor. You can reach Driscoll Insurance and Financial Services Incorporated at 412-833-1500, and they are located at 2738 South Park Road, Bethel Park, Pennsylvania, 15102.